Every day on the Suncoast, thousands of people struggle with the challenges of Parkinson's disease, the muscle freezing, tremors, small shuffling steps, and loss of ability to swallow or speak. And as hard as it is to endure, it can be even more difficult to find treatment. But there is hope. It is a nonprofit group on the Suncoast called Neuro, and Medical Director Dr. Dean Sutherland is here now to tell us about it and to tell us about a way that you can help out. Thank you so much for coming in.
Hi, Heidi. Thank you for having me.
Thank you for coming back. I'd like to disclose that I'm very involved with Neuro. I'm on the board, and my parents are very involved with Neuro. My mom is Parkinson, and it is a wonderful group that provides services that very few in the whole state provide. Tell us.
That's right. We've actually expanded our services to include things that nobody actually in the state or even most parts of the nation have nowadays. We have an integrated medicine program that has to do with Tai Chi and ballroom dancing and acupuncture, a lot of different things that you would normally associate with alternative medicine that's available. And actually, if you look around, it's not available anywhere else in the United States as a true Parkinson's clinic, which we've developed. So we're very excited about that.
Tell us the clinics that happen each month.
Each month we have the ability for people to come in and be evaluated not only by myself, but also by our nurse coordinator, who's able to put together a care plan for them, which is individualized. So, for instance, if someone is falling down a lot, then perhaps they're not going to do well with acupuncture, but they might do better with Tai Chi, or they might need some physical therapy and occupational therapy at that point. Alternatively, if they're having problems with swallowing, they might want to see a speech therapist, but also maybe you get involved in some other activities that allow them to get out and sing and do things. So in other words, we're trying to do very broad treatments for everybody, individualized treatments. So in addition to myself and the nurse coordinator and the PTOT and speech therapy people that you would normally see in the clinic, we also have a lot of seminars that are available for people to go to. We have a very big one coming up in January. We're going to bring in a stem cell researcher to talk about the latest. When the skin cells get transformed into being stem cells, they can be given back to Parkinson's patients potentially. That's going to be a real winner. We do that every year.
Right, and it has a huge, huge crowd. But all of these things take a lot of money to provide, and there's a way for you to help. There is a golf tournament coming up, not this weekend, but the next weekend. Tell us about it.
So the golf tournament's going to be at Heritage Oaks. It's going to be a lot of fun. Mark Bisgeyer has helped us to organize this along with a lot of other volunteers. But it's going to be a typical 18-hole tournament starting around noon. We're going to have fun. There's going to be prizes, you know, if somebody wins a hole-in-one. There's also going to be some door prizes that are given away and some raffle items. There's going to be a large screen TV. There's going to be a lot of coupons for local restaurants.
I think one of the holes has $5,000 prize, right?
That's right.
So a great way to make some money, too, if you would like to come.
And have fun with your friends.
Well, let's tell everyone how they can take part if you're interested. It is the Neuro Challenge Foundation Charity Golf Outing, October 24th. Happens at Heritage Oaks Golf and Country Club. If you'd like more information, call 400-7867, or you can call the Neuro Challenge Foundation helpline 926-6413. And of course, if you need more information, go to our website, mysuncoast.com, and click onto Health Smart. And you might be hearing about this one more time before we have the tournament, because we might be talking about it. Dr. Sutherland, thank you so much for coming.
Thank you.